can even see little people faces in there, which is completely appropriate for a supportive playgroup session. Lovely to see some kids on the call. Great. Ah, Wurundjeri country. Hi, Belinda. Yeah, you're not quite on the map when you're down that way. Fantastic. Great to have you. Thanks for dialing in from down in Victoria. Fabulous. For those who've just joined, if you haven't used the QR code, you can join Menti either through your phone or through your web browser on your computer there as well. We're going to be using that for a later part of the session, so it'd be fabulous if you can jump on there and just drop a pin wherever you are in New South Wales to let us know what country you're dialing in from today. We're going to kick off in about 1 minute. It's great to have you here. Looks like we're represented really well all along the coast of New South Wales, which is wonderful. Fantastic. All right, Susan, I reckon we're probably good to get started. We've got 80 people on the call. Right. Which is a solid number of people representing from supported playgroups across New South Wales.
Certainly is. I'm just going to check that you can hear me.
Oh, good.
Can you hear me? Yep, good.
Hearing you loud and clear.
Oh, good. That's what I wanted to check. I've made that mistake before. Good afternoon, everyone, and welcome. It's wonderful to see so many people of you here today. I'm Susan Watson, the CEO at FAMS. I'd like to start by acknowledging the traditional custodians of the land we all meet on today. I'm in beautiful Gadigal country, and I'd like to pay my respects to elders past, present and emerging, and extend that respect to any Aboriginal or Torres Strait Islanders with us here today. Supported playgroups are an essential service provided by our sector. They're a place to belong, feel connected and supported to thrive. They also provide the critical soft entry points for families needing extra support that begin in ways that feel non-clinical and relational. Your obvious interest in this exciting evidence-informed enhancement programme gives FAMS the confidence in our plans for a $1.5 million budget proposal to government. This morning, I'm going to give a quick history of why we call this special sector conversation. Then I'll hand over to Annette Michaux, Director, Policy and Practice from the Parenting Research Centre, to give you more in-depth information on small talk and big yarns. Lauren Stracey, our Sector Engagement Manager, will then lead you through a discussion and consultation process. As there are so many of us, please keep yourself on mute. If you have any questions, please use the chat, and there will be some time to respond to questions at the end. We would love to see your faces, so please keep your cameras on, although as Lauren did say that we are recording this session, so we respect the fact that some of you may not want to do that. So when Annette came to talk about the potential of a partnership in the rollout of small talk and big yarns in Victoria, we jumped at the opportunity. Already well established in Victoria, small talk has been adapted for Aboriginal and Torres Strait Islander families as big yarns. Prior to this meeting, we tested the water with some of our key partners. We've had an initial conversation with our Minister, Kate Washington, who is a huge supporter of playgroups. She is on board, but says she has no funding available at this time. And we're working on this. It's budget time, after all. DCJ are also keen supporters, and it's great to see our DCJ colleagues here too. FAMS is also in consultation with ABSEC on how an adaptation of big yarns could be rolled out in New South Wales. Of course, our most important partners are here today. Without you, small talk and big yarns will not be successful, and we believe the power of your voice in our proposal to government is pivotal to getting it over the line. So, without further ado, I'd now like to hand over to Annette from the Parenting Research Centre. Thank you, Annette.
Lovely. Thank you, Susan, and thank you all for being here today. I'm also on Gadigal land, quite near the ocean. Gadigal land kind of focuses around the inner city of Sydney and down to the coast. In fact, my local community, Coogee, means stinky place in the Aboriginal language of the local area, and it's only stinky when the seaweed comes in. The rest of the time it's absolutely beautiful. So look, I'm going to share some slides with you, and I might not be able to see all your faces. I've got a couple of colleagues here from the Parenting Research Centre, Vince and Kate, which is wonderful because Vince in particular has been involved in Smalltalk more or less from the beginning. So rest assured, if you've got more detailed questions, we've got someone who's got a lot of expertise in the Smalltalk initiative. So I'm just going to share my screen with you now, and hopefully you can see that. As Susan said, the story here is really not long after Susan started, we had a wonderful conversation in the sunny space at the hub in where FAMS is based, and talked about some of the initiatives that the Parenting Research Centre has been involved in over the years, and how passionate we are about Smalltalk, because it's kind of an initiative rather than a program, and by that I mean it really enhances what people already do in playgroups, so it doesn't feel like, you know, a program coming in from outside and being enforced on people. Also, it's been developed in Australia, so we're really keen to partner with FAMS because you're such an important network of workers with the opportunity to improve outcomes for children right across New South Wales, and really interested in how we can make Smalltalk available to as many families as possible, given that it has got a good evidence base and it has worked right across another state. So it hasn't just happened in one or two places in Victoria. All the Victorian supported playgroups that are funded by the state government in Victoria have a Smalltalk enhancement. So it's really been effective over the last 10 years. So I really wanted to thank all our colleagues in Victoria for the amazing work they've done over the last 10 years, and the Victorian government for putting funding in, and also Paul Ramsay Foundation, who gave us a little bit of money to see what the opportunities were for scaling up Smalltalk. So it's been a really wonderful conversation, and to see the enthusiasm from FAMS and from playgroup providers right across New South Wales to help us look at how we could look at the possibilities for scaling Smalltalk. So why Smalltalk and what is it? Well, it's a really important initiative, and the need for Smalltalk is really about how we can better help children thrive. And we know if parents are supported in strengthening their relationships and that relational environment that Susan mentioned, we can really strengthen early development. It's an initiative that really works well in supported playgroup settings. We know how important, obviously, parents and carers are absolutely critical to children's very early years, and we designed Smalltalk as a set of strategies. So again, as I said, it's not a kind of manual, it's a set of strategies that can be taken into early childhood environments and build on existing strengths of supported playgroups. So in a nutshell, it really shows parents how, by enhancing the early home learning environment in particular, they can help improve those developmental outcomes for children today, but also into the future. And I'll come back about how we're faring with that in a minute. And the other reason we need Smalltalk is because we still have many children in parts of Australia that are what we call developmentally vulnerable. I don't like that term, but it's what they use in the early childhood index, and it's a way of understanding areas that we might need to work on with children to build their skills. And about 1 in 5 children are developmentally vulnerable in one or more domains. And this has actually gone up rather than go down. We were seeing some gains, but it's actually starting to go down. So there's a lot more work to do in this space. So more than ever, we need to support children kind of really early, as you all know. The other piece of really important information, and I know many of you have now heard about the Australian child maltreatment study. There's some very sobering statistics in that about how children are have experienced abuse and neglect, particularly the effects of emotional abuse and sexual abuse on children, and how we need to really increase our prevention efforts to strengthen families early. Clearly the way the system's working at the moment is not prevention focused, except where we have organisations like yours running supported playgroups. So how can we enhance those to provide more support to families earlier so we can build these strong relationships that are so protective of children? So small talk's a really great early intervention strategy to really build that relational environment. So what is it? Small talk's really about extending communication and thinking skills. And it's kind of got these 5 elements. It really helps connect children and families to communities. So parents meet other parents, as you would all know, and it provides formal and informal supports. Really centrally is this stimulating learning environment. So that's part of what you do. This builds even more onto that work around activities, reading, play, and establishing routines so that those are transferred from what people are learning at supported playgroups into the home. Building parental confidence, because we know there's a really strong link between parents feeling confident and practicing positive parenting strategies and reducing those kind of more difficult and not necessarily abusive, but parenting that's less positive. Improving the frequency and quality of everyday interactions. So, of course, we want parents to talk more, interact more, tune in, be responsive. Most parents are already doing this, but we want more and more and more of it. So really, how can we enhance those positive interactions? And the final thing is enhancing self-care. We know for parents to look after children, they need to be finding the time to look after themselves and be healthy, well rested. Very hard to do, particularly if you've got 3 or 4 young children. But having those moments of self-care are incredibly important to reduce stress and to increase those positive relationships. So what are we talking about when we're talking about these everyday interactions that we want to build on and enhance? There are things that you already know, but how can we get them to happen even more often? So it's about supporting parents to be warm and gentle more often, to tune in and to be more responsive, to follow their child's lead and become engaged in activities that the child's obviously interested in, to talk and to listen, to really build that vocab and to make the most of teachable moments. So there's everyday moments of interaction where we can, practice counting or point at things and point and label, all those things that we know are really effective, but doing more of them. So more of those kind of things. So that's kind of your basics of small talk, and those are the kind of outcomes we're looking. Those are the processes that lead to the outcomes we're talking about. So there are 5 incredibly clear strategies, and I think that's what's been really helpful. They're clear, they're not complex, and people can see how they can build on those in terms of supported playgroup as a platform. So it gives you a bit more structure and guidance as a worker or facilitator, and it also gives parents a bit more structure and guidance about how to do those things at home. So Susan mentioned big yarns. I'll also mention the small talk materials have been adapted into 8 community languages as well, as you can see on the slide. So Arabic, Chinese, Dari, Karen, Persian, Farsi, Vietnamese, Burmese, and Hakachin, which is a kind of type of Burmese or Myanmar language. So that's really useful to have it, to have those adaptations for different communities. The other area that's been adapted is the big YARNS adaptation of Smalltalk. So this was developed with VACA, which is the Victorian Aboriginal Childcare Agency. That has about 1,000 staff, so it runs a lot of services and programs itself. It's a bit like ABSEC in New South Wales. It also is the peak body, but it runs services as well. And VACA, Parenting Research Centre, and YouthWorks partnered to adapt Smalltalk for Aboriginal and Torres Strait Islander families in Victoria. So this is a practice model that those staff in playgroups in Victoria can use, and VACA actually used the supports in a lot of their services as well. So this is something we could adapt to the New South Wales context. I mean, many of the principles would be the same, but there are probably some adaptations in terms of language, and we have talked to a couple of key organisations in New South Wales, and of course Susan, as she mentioned, is having initial conversations with ABSEC as well, because we wouldn't want to go forward without consultations, obviously, with Aboriginal organisations in New South Wales. So that's really nice to have that adaptation. In terms of successes, I suppose it all comes down to what do we know about a Smalltalk and how effective has it been. We were really fortunate at the very beginning to do a really substantial piece of research that sat alongside Smalltalk. So we wanted to know really how best to enhance that home environment and the home learning environment for really young children. Particularly because we wanted to focus on children who weren't necessarily going to things like early childhood or childcare centres, because we wanted to get in before kids were 2 or 3 years old, wherever we could. And so we looked at designing something, and it took about a year to design the research, working with communities. And we looked at what platforms already existed, where families already went. So that's where, as you guys know, the supported playgroup platform came in, and we built Smalltalk as an enhancement. About 2,000 families were involved in the research. So it was a fairly big study, and it was quite a strong methodology. It's called a cluster randomised control trial, which means we tested Smalltalk supported playgroups against standard supported playgroups, so we could see if it was actually making a difference. And through that research, the results have shown a difference, and we were able to show that supported playgroups with that Smalltalk enhancement improved children's learning and developmental outcomes. So this is, as I said earlier, this is something that's been successful where it's been well implemented. And I would stress the implementation, as Vince knows, as it's not just something you get trained in and go away. You need some support to make sure that you're kind of embedding it in your service or centre. And so we started this initiative in 2012. So it's actually been being implemented for 10 years. It's probably the biggest implementation of an evidence-based initiative in Australia and right across a whole state. So because we've had that 10 years, we know a lot about how to manage it, how to do it effectively, how to support organisations that are having more difficulty in implementing, what extra supports do they need. But anyway, just finally around those successes, as you can see from the slide, it showed greater improvements in parent-child interactions in the home environment than those playgroups where Smalltalk didn't exist. So standard supported playgroups versus Smalltalk playgroups showed better and more outcomes around those interactions. Secondly, families with a greater level of need and more need for extra support benefited more if they got a bit of home coaching. So this is a lovely piece of the Small Talk initiative. For families that need a bit of extra support, they get about 5 home coaching sessions, which we can talk about more, but it was a really great enhancement. And with those 5 extra sessions, obviously going into someone's home, practicing some of the strategies at home with them really bolstered the impact of Small Talk. And we've also been following these, or independent of the Parenting Research Centre, La Trobe University, colleagues there have been following up the outcomes of Small Talk over time. And it's fascinating that for such a light touch intervention, it's not a heavy thing to be doing Small Talk. We are seeing outcomes that are lasting into the early years of school. So we looked at these kids when they turned 7, and they're still showing better spelling and word recognition. So it's really exciting to see and understand that in settings like yours, we can see these kind of results. So we've had about 4 publications in peer-reviewed journals about Small Talk, which is fantastic to have that kind of evidence around the outcomes of Small Talk when it's well implemented. So finally, just there's plenty of information about Small Talk that's available, and we can certainly link you to both the Small Talk website through our FAMS colleagues. Thank you so much for listening to this piece, and really keen to hear from you about what you think. And I know we're going over to Lauren in a sec. But thank you for listening. That's kind of the ins and outs of Small Talk in a nutshell.
Thank you so much, Annette. That was, yeah, I think for everyone, you can see why we're so excited about this particular enhancement program. It's evidence-based is just phenomenal, and the impact that it's having on children and families is really, really exciting. I'd ask you if you could now jump back into your Mentimeter, because what I'm wanting to do is take you through a bit of an interactive section, because today is really about making sure that we are hearing from our sector as to whether they think that this would be something that would work for you. We want to go to the Minister before budget and say to her, you know, our whole sector is keen and wanting to be part of this. And I guess some of the things that I'd love to talk to you about before we go into that Menti session is really about what this might actually look like for New South Wales. If successful, in partnership with the Parenting Research Centre, we'd be seeking to train all of our TEI-funded supported playgroups across New South Wales in either Small Talks or Big Yarns. What we're wanting to do is do a rollout across New South Wales that is concurrent. So while Small Talk is ready to go, Big Yarns will take some development and some time, and we're already in consultation with ABSEC as to how that might work and what sort of things we might need to be mindful of. This would be really about supporting all of you to be able to provide this enhancement program in a way that's meaningful to families and is able to assist in amplifying the exceptional work that you're all already doing in your playgroups. The training, as Annette kind of alluded to, it's not just a one-off training thing. It's about having ongoing support and coaching, as well as resources for you to use with your families on top of the initial training with your facilitators. I'm sure that many of you are thinking, you know, I'm not quite sure about taking on a new program with all that's happening, especially leading into reform and the sector changes that are happening as well. But what we're really wanting to do is actually decrease the current burden. So the program would be able to be rolled out across New South Wales in stages. We're looking at probably a 3-year plan. With a succession plan for staff turnover, because we know that there is some movement in the sector. So that's really important that we ensure that all of the sector is keeping up to date and current in this training. The other thing is that because it's an evidence-based program, it'll actually be able to be linked to DCJ's core components, which you probably, if you haven't seen already, will be hearing about shortly. And it will also be really supportive of services for recommissioning, because what we know is that if you can demonstrate that you've got an evidence-based program being delivered in your supported playgroup, you're going to be in a stronger position. So it's a really useful piece for that as well. The other part is that we all know that DEX is part of service delivery these days, and because the Small Talk and Big Yarns programs have got an evaluation attached to them already, they have also got evaluation tools that could be used as well. And what we'd want to do is support the sector to be able to use those tools to feed into decks rather than increasing your reporting work, because we know that already people are feeling a bit of a burden around that. We want to make things more useful and being able to capture the voices of children and families in ways that are meaningful. This morning, I was actually lucky enough to spend some time with a parent who was involved in the Victorian program. We actually had about an hour on the phone together, which was really wonderful because it gave me a sense of actually what is it like for a parent to go through small talk and how does it actually help. She was a rural parent. She was incredibly isolated, a mum who it was her first bub. And she could not speak more highly of her experience. She said to me, actually, it was interesting. She was saying that she had come from a family where warm and gentle. And I thought it was interesting that she was straight into the language of warm and gentle. And I was like, gosh, I'm just kind of ticking everything because she's embodied that language now. So warm and gentle parenting was kind of her experience of being parented as a child. But for her partner, he had had quite a harsh parenting upbringing. So what had happened for them, they actually got the extra home coaching and they made sure that they had it together. And what it gave to them was a shared language about what was happening for their child. And she told me stories about times when, you know, her partner was, I think he was a FIFO worker. So he'd be going away for long periods of time and coming back and then having some rebound dysregulated behavior. And it was through the coaching, she was able to see that actually he's not rejecting her, which was what was her internal story, that actually he just needed some time to connect with dad again. And she said it was just so essential to how confident she felt as a parent. And she said that's just one story that she has. She can tell so many stories about how, you know, after having a really difficult pregnancy and a difficult birth and then some health issues after, that having somebody just telling her, you know what, you're doing a good job and, you know, these tiny adjustments, they're going to make such a difference to the way you're being able to care for your little one. She just said that her confidence just grew from what was quite limited confidence, particularly being so isolated. So for me, hearing those stories of like a real parent and being able to connect with her about how beneficial, it just really amplified my enthusiasm for meeting with you today, which was really wonderful. And she's going to be one of just a few parents that I'm going to be chatting with over the next couple of days, so that when we go to the minister next, that we can have a conversation that isn't just about the data, which is so good, but also is about the real stories as well. So this is where I love your input. I'm going to pop Mentimeter back up and I'm going to pop this one across. So to our first question. So once you've gotten back onto Menti, if you could just put down what you're thinking at this stage. So from everything that you've heard shared by Susan, Annette and myself, how interested are you in implementing small talk and big yarns at your service? So I'll just kind of let people drive that for a while. And if you have questions, what we're wanting to do is we're going to try and answer them all today. But just given the fact that we've got a limited amount of time today, we're also going to develop a Q&A question sheet that we will send back out to the sector. So if you have questions, if there's something that's burning for you right now, please pop it in the chat and we'll either get to it today, or if there's a barrage of questions because you're all just fascinated and want to know every bit of detail, we'll create a document that we'll send back out to you. So far, it looks like we've got about 35 people that have responded out of our 94 here today in session. So if you haven't already been able to link in to that, that'd be wonderful. But so far, it's looking like people are pretty keen, which is a really wonderful thing. I'd be keen to hear if people have got things that they're ambivalent about. Can you, yeah, I'll post the Menti. If you go into menti.com, it's 54671011. So you can just jump into the web browser there. Thank you. Yeah, if you have got questions that you're wondering, or if there's things that you kind of are wondering about in terms of, you know, how it might work for you, please pop it in the chat, because even if we can't answer it today, we will be able to get back to you, or it might be just something that we actually need to mull over ourselves as well. So really keen to hear all of your questions. Does small talks require home visits for every family? My understanding is no, it doesn't. Annette, do you want to jump in with that question while we're just getting people to pop in whether they're interested or not?
Yeah, no, it certainly doesn't. It's just for families where they need some extra support. So yeah, the majority of families probably don't need it. But yeah, it's available to a smaller number of families.
Great question. So typically the way that it works is it's part of the way that you're delivering your playgroup. So it's something to enhance what you're already doing to support you to be able to get even greater benefits for children and families who are entering that small talk space. The thing that I loved as well when I was chatting to this mum, she was talking a lot about how she'd talked to other parents about it as well, and she'd talked to her own mum about what she'd learned. So it wasn't just that she was kind of being influenced as an individual, there was kind of this beautiful ripple effect that was happening out to her family circle. And for her, she was a very, very isolated mum. So being able to have somebody be a sounding board for her on the struggles she was having as a parent was just really, really essential. It was great. Is there additional funding to support the program? That's what we're looking for. So part of today is actually about us being able to understand the interest of the sector and go back to the minister and say, you know what, we've got, you know, out of 55 people, 4.1% of people said that they would like to implement this program. So being able to capture that kind of data is really going to be essential for us to be able to demonstrate why this small investment in funding is going to have such a big influence and impact for the families across New South Wales. So hopefully watch this space. Great. Does anyone else, have we all been able to get onto Menti okay to be able to pop that in? So if you either go, if people want to scan the code on their phone, I can go back to the QR code. Is that helpful? Do people want the QR code? Otherwise, you can just drop in, search on your web browser or on your phone, menti.com, and then pop in the code that's just up the top there as well. Is it implemented in a soft way throughout the playgroup, or is it more in structured conversations with resources? Do you want to talk to that one either? Yeah, go for it, Annette.
Yeah, and I don't know if you can unmute Vince as well, because there's a question about it's a question about big yarns as well. Sorry, the question was, could you say it again?
Is it implemented in a soft way throughout the playgroup, or is it more structured conversations with resources?
It's pretty informal, isn't it, Vince? The idea was actually that it's not kind of formal. Let's have a small talk session now. It's meant to be more individualized, so that, you know, when you've built the relationship with someone who's new, so they're not kind of confronted with all this stuff about parenting. It's very much walking alongside, noticing and building on positive interactions and kind of adding on from there. So it wasn't designed to be structured. I know a couple of the Victorian playgroups now do more of a structured approach. So over the years, there have been some adaptations, but it's absolutely designed to be informal and individualised. I don't know if you've got anything to add, Vince. If you, I don't know if you can unmute. Yep. Thanks.
Yeah, just very quickly, I'll say that it can be both. It can be a bit of both. So the idea is that it's done within the normal tenor of a playgroup. So as you're delivering playgroup, you introduce parents or talk to individual parents in a very casual way. And the resources we have available aren't required to be used. They're there as a support. And we call them conversation cards because it often provides you and the parent something to focus on and talk about. So it's done in a very casual way. So the idea is that it's not a formal psychoeducational program where you present content formally. Rather, you do it as you interact in the normal way that you run a playgroup.
Fantastic. There's such good questions. There's another one here. Does the program have an element to be able to support families that have developmental concerns for their child? If so, is there support for the playgroup facilitator how to have those more challenging conversations with the parents when there are concerns?
I'll take that one as well. If you want.
Go for it.
During the training, we do talk about raising concerns with parents as an issue that you might encounter. The idea is that we're not asking supported playgroup facilitators to do more than their role. The way that it works is we think that the small talk strategies and ideas within small talk are are things that supported playgroup facilitators can adequately do within their normal role as a supported playgroup facilitator. But if parents do raise developmental concerns, we talk to the we do in the training train people how to have that conversation in a supportive way, and how they might then support the parent to seek the appropriate assistances if required. So we also have a speech and language enhancement training program available in Victoria currently, which may be a feature of any rollout in New South Wales as well. So we do understand some of the concerns people have about the challenges that they experience with families, and we try to address that as much as possible in the training event that we run.
Fantastic. There's another question here about wondering whether people need to employ someone else or do you need another worker? So do you want to speak to that as well, Vince or Annette?
Yeah, I think Annette answered that question, I think, earlier, and I think her response was a good one. It's really the task here is to skill up facilitators to be able to incorporate small talk within their normal delivery of the program. So you don't need another person present. It happens in the normal feature. If you've got a group that runs for an hour and a half to 2 hours, we say that small talk on a weekly basis doesn't take any more than 10 minutes at the most with any one family. So you walk around the group, you talk to each family in a casual way, introduce the content, and then move on. So the idea, it's not a test, it's not a program as such. We really see it as an enhancement to the service you provide. You're already engaging with families, so the idea is you continue to engage them, give them some strategies that have been shown to be effective at enhancing children's learning and development. So it's doing some extra things as part of the work you do, but happens in the normal way that you deliver a playgroup.
Yeah, that's fantastic, because I think that's what we were really excited about. It's not doing something new, it's not creating a new thing, it's kind of adding to what's already working beautifully to be able to lift up and get even better outcomes for children and families as well.
Yeah, I see there's a question there about what happens if it's the facilitator has concerns about the child's behaviour. And in fact, the way that we present that information in the training is to focus on both directions. So it's where the parent raises concerns with you, but if you've got a concern, how you can subtly and supportively raise those concerns with a parent to help them seek the supports or the resources they might need to address the concern that they have, or that you have. So how you can talk to them about that. Many of you will be skilled at interacting with parents anyway, so it really be reinforcing many of the skills you already have.
Fantastic. There was another question here about Big Yarns, whether Vince, you can speak to a little bit about how that worked and what you noticed and what was different in that program.
Yeah, I think we have to be very clear that what happened is that in Victoria we were approached by a couple of agencies, Aboriginal community-controlled agencies, and they wanted to embed small talk within it. And rather than just give it to them and say, do this, we worked with them to identify the way they delivered services and how they interacted with families, and then try to adjust the program to suit those circumstances. We would imagine that that would have to happen in New South Wales as well, which is why I think, Lauren, you've been looking at engaging with ABSEC about this to really contextualise it for the local services. But what we found when we did the work with these agencies, the Aboriginal controlled, community controlled agencies in Victoria, VACA and the like, has been that there hasn't been any need to change the content. It really is just some of the process and some of the design that was originally involved in the program. So VACA took on the role of redesigning the materials to suit their needs, and they reproduced our videos, which were old and dated,